Referring clinicians should have an open and honest discussion with their patients about the importance of screening. The Society of Breast Imaging and the American Cancer Society all agree that screening at age 40 every year is what provides the biggest benefit and the largest drop in breast cancer mortality. Every woman by the age of 30 should at least have a conversation with her physician regarding specifically her risk for developing breast cancer. It should be tailored to each patient. It's not a one-size-fits-all because every woman's risk is different.
When we're talking about any group that is in a high-risk category, there needs to be a plan. And in order to do that, the conversation has got to include their physician.
There is a really good test called screening mammography. We as breast imagers and the whole breast imaging team, we're a resource that they can call upon if they have questions about how to handle breast health situations.
Their patient's going to be, one, handled in a caring way. Two, the information's going to be delivered promptly. Three, that the accuracy of what the radiologists are doing is high. And four, that the follow-up is excellent.
The difference between Solis, and I would compare us to any other breast center, is that we, and I, as the Chief Medical Officer at Solis, hold every Solis mammography center to its highest standards. We run every breast center to the highest and most clinically relevant accreditation standards, whether it's a screening-only facility or whether it's a facility that's inside of a hospital. You get the same technology, you get the same patient-centric focus, and you get the same clinical expertise.
To be 100% dedicated to doing breast imaging, it allows you to get that feedback that is necessary to continue to improve.
When you look at the scientific data, dedicated breast imagers have a lower recall rate. They have a higher cancer detection rate. They have a better positive predictive value. If you have the same exam being offered at the same price point to the patient, why not send them to a better center?
We are breast healthcare experts, and we have a knowledge base that is pretty extensive. We're really great at doing the workup and handling the flow of information between the patient and the breast imager, as well as the breast imager and the referring healthcare provider.
I pride myself on being a resource to my referring clinicians. I'm on the phone several times a week with referring clinicians answering questions. So I think that's an integral part of my job and one that I find very gratifying and incredibly important for the patient as well, so that there is no loss of continuity, so that people don't fall through the cracks. That's how you deliver good care.
I strive to create a space where the patient feels confident and comfortable. There are ladies that I have seen for years, and they come to me now, and it's, Dr. Ford, I had this question, and I knew that you would be able to answer this for me because I trust you. That's basically what it is. It's a building of a trust relationship between you and the patient.
That's how we've designed our practice at Solis. It's critical that you are communicating with the patient. We're not like radiologists in the past. Go home and call your doctor if you want information. When the patient leaves our facility, they know why they were there, and they know if they're done or if they're not.
There is definitive benefit for screening mammography. We can detect small, early curable breast cancers very reliably. The fact is that 95% of those breast cancers that we find are completely curable. They're small, early stage breast cancers. That's our job in mammography. Find cancers when they're really small. We can treat them successfully, and women's lives can ultimately be saved.